Yes, good morning indeed to you, Desiree, and the viewers at home. We are indeed in Atteridgeville here in Pretoria, just checking what is it that is happening here. What is happening is we're seeing quite a lot of educators coming in. But I think also quite importantly in the morning, we did see the various teacher unions come out, the leadership of the various teacher unions coming out to get to get their vaccines, to get vaccinated. We saw that, and a lot of them have already gotten those vaccinations. We also understand that they have vaccinated over 40,000 educators and staff were vaccinated yesterday across the provinces, except in the Western Cape as well as in Limpopo. We understand that the Western Cape is going to start their rollout today. Limpopo will then proceed on Friday with rolling out that vaccination. But we understand there were also challenges across the various provinces. So I am joined by various, union leaders. I'm joined by Mr. Sibusiso Malinga from NATU, as well as GS for SATU, Mr. Mugwena Malulega. And they're just going to be telling us what has the response been from their members on the ground. What is it that they're finding? Understand, as I said, that there were challenges in certain places. But let's also just find out from them how are educators, reacting to this. But Malinga, thank you so much for talking to us.
Thank you.
Can you just please tell us on what are you finding with your members on the ground in terms of, the rollout of this program? Are they happy? Are you finding that teachers are taking on to getting vaccinated?
Thank you so much. Members are very happy and they are cooperative, irrespective of union affiliation. But we had some problems in some areas like the Free State. We were told that in Free State they did not adhere to the rules and regulations, that is social distancing and everything. So we try to say they must look at that because we cannot compromise the lives of our teachers. Somewhere in KZN we also got the information that in KwaZulu teachers were also chased away. So we encourage the Department of Health to make sure that they bring enough so that teachers will get actually vaccinated on time. And we must also take into consideration that this will stabilize our sector. So it's the right thing to do. We encourage them to take vaccine.
And you also I think you touched on Mpumalanga that there was issues of the age issue, the under 40s.
Yes, we heard that in Mpumalanga in one of the centers. Teachers were not vaccinated, those that they age below 40. And we actually said that was very bad because we did not allow or we did not agree to that nationally. Nationally, we agreed that the age restriction is actually removed. Therefore, teachers, irrespective of age, they should be vaccinated because they need to make sure that should they go back to school, we are all happy that we all got vaccinated.
Thank you so much, Mr. Maling. Mr. Malulega, you were saying that there were issues of fake news that were making the rounds. I think that was a concern that you said you wanted to address.
Yes. First and foremost, let's take this opportunity to express our gratitude to the people of our country for allowing the education sector to be in the front of the queue because we want to protect the future. Yes, we have seen that there was a WhatsApp message that was circulated yesterday that was saying vaccine is not enough. We want to appeal to our people, to appeal to our educators, to appeal to education support personnel that there is no such thing like the vaccines are not enough. The vaccines are enough and therefore they will be able to cover everyone. So we are appealing that please go out there and get vaccinated because it is going to protect you, protect your future and protect the future of our children and the communities. It's very important to stand in solidarity. Let's show compassion, let's show kindness and ignore fake news. The unions, 5 of them, are working together to provide information in all the platforms. Please, if anyone has got an issue, phone your union or any other union. We have the same information so that we are able to defeat this particular virus. And the only way to do that is when we cooperate. And the other problem was in the Eastern Cape. No age restriction. Everyone must be vaccinated. Increase the number of sites in Mpumalanga and increase the number of sites in KwaZulu-Natal so that we don't have a problem of the vastness in terms of transportation. So we really are grateful for the number of educators, education support personnel that are going out for vaccination. We encourage them to do more.
And also, maybe just before I let you go, Gauteng is recording high cases, high numbers. We're seeing that in schools. Is there concern among members that you're picking up as a union? Yes, we understand we are having the vaccines, but going forward, or in fact right now, what are you finding there on the ground in terms of your educators?
Yes, in Gauteng, yes, we are recording high numbers of cases, and we are encouraging our principals and our education personnel to making sure that we follow the protocols, in making sure that where there are cases, the schools that have got more cases, they've got to shut down so that they're then able to making sure that there's a formidable tracing and tracking system in place so that we save more people. The schools that have not been affected must not also wait to be affected. They must follow the protocol by wearing masks, social distancing, washing of hands, and making sure that we are able to spread the word. So we are really concerned about the high numbers, and therefore we're going to engage the Department of Education in terms of the differentiated approach of closing the schools so that we are then able to save lives.
Thank you so much. Desiree, you've just heard there, and that was, leadership of NATU as well as SATU, just telling us about, the various problems that were spotted from yesterday. They mentioned in Mpumalanga there was an issue there where educators under 40 were then turned away. I understand it also happened within the Eastern Cape where teachers that were under 40 were then said that they had to, they weren't ready to vaccinate them. But also just saying, I think the encouraging message that they're saying is that let teachers go out there in their numbers, as well as the issue of vaccinations. You'll remember that the Deputy Minister of Health yesterday, Dr. Pata, had said that they were going to receive within the next few days 700 dose batches of J&J, and this would then be also shared with the education sector to supplement that 300,000 vaccinations that are currently being used in this rollout. And also when we spoke to Minister Angie Motshekga earlier on, she was also told us that she's confident that health will not leave them in the dark in terms of sharing those vaccinations, that there is enough. They are going to complete, and they will have that 500,000 vaccinations that they need to ensure that everybody in the sector is also has access to these vaccines and is able or has that choice to go and vaccinate. And also just saying that the issue of overcrowding, I think also leading on to part of the issue of people feeling that there's not enough, but assuring teachers that there is enough, and they seem to be quite happy with their first day of vaccinations. Also saying that with the 48,000, they could have actually vaccinated more in terms of their rollout plan, but now that they know better, that they were lessons from that they had learned yesterday in terms of the numbers, that they are able to vaccinate on a day-to-day basis. But I think at the end of the day, when we see the Western Cape also coming in, that number should probably also go up. By Friday, all provinces will be vaccinating. That should also, we'll see the numbers drastically going up. But, we are going to be here and other vaccination sites. But when we speak to educators, quite excited. I mean, people were here. This was meant to get underway at 9 o'clock. By 8 o'clock, teachers had already started lining up to say, they are ready for this vaccination. And, they just want to go back to a sense of normalcy. And it's back to you, Desiree.
Thank you so much, Mahlako. It seems orderly enough. Now on to this